It's Constance here, your lactation consultant presenting for Parenting Genie today. And today I would like to give you a little bit information about colostrum. Now, colostrum is your first milk, if you like, and it gets produced by your body during your pregnancy from about 16 weeks onwards. So most mothers don't even know that they're producing colostrum, but some mothers may start getting a little bit of leakage in the second or third trimester. And some mothers even have a bit more than just a little bit of leakage of their colostrum. Now, what is so special about colostrum? As you may have read and heard many times, it's your baby's first food. And it's very nutritious and it's high in antibodies. We call them IgA. So they protect the baby from illnesses, especially infection. And also there's advantages in lining the baby's gut and protecting the baby's gut. And colostrum is also quite high in white blood cells, which again fights infection if there is an infection. And there's other properties like prebiotics. And again, they help to develop a healthy gut bacteria. So you probably heard a lot about the microbiome. It's been talked about all the time at present. And yeah, colostrum is certainly something that will help to kick the baby's gut off to a really good start. There's also growth factors in colostrum, which again help protecting the gut. It comes very small in volume, so babies don't need a lot of that colostrum, but they certainly do need it. It's rich in protein and in vitamins and minerals. It lowers the risk of allergies and asthma. It supports long-term immunity and that immune system. And it also supports brain growth and neurodevelopment. And then there's a lot of other things. It's actually one of the things that it will help. It's like laxative. So it helps the baby to pass that first poo, which is called meconium. And it also helps in reducing the risk of jaundice because it flushes out the baby's bilirubin, which is one of those things that can cause jaundice in the baby. And a part of jaundice is perfectly normal. It's part of the transition from the womb to the world. But if it becomes too high, that's jaundice, or too strong, then that can make a baby sleepy and not wanting to feed much. And okay, so now I'd like to just give you a little bit of an idea how to express colostrum and what you can use it for, and why you may express it before your baby is born, and why you want to express it after your baby is born. So I've got my breast here. So what you would be doing is you would be using your thumb and your index finger. Just put it around a glass, just to give you a little bit of an idea. So then you have got that C shape of your hands. And what you do then is, what happened now? Sorry, I am so sorry. Something has just happened and I was disconnected from you. So that was some kind of techno problem. Anyway, I'm going to continue now. So I just showed you how to hold your hand. And then if you've got your breast, you would do some breast compression here with your 2 fingers. It's almost like you have the C hold and then you have the nipple in the back, in the middle, and you express. So you don't do anything like rubbing. You just keep your fingers in the same spot, and then you will find that there's drops of colostrum coming out. And colostrum is quite thick, so it doesn't sort of really run that much. So sometimes you need to bend forward a little bit to maybe collect it in a little cup. And this is not colostrum, but it's sort of make-believe colostrum. It's a little bit of cream with turmeric to make you think that there's colostrum in it. So you can then do this and express it into a little cup, plastic cup. The other option that you have is a spoon. So you can express into a spoon. And then what other mums do, and what they're often taught by their midwives, is to use a syringe and then suck the drops that come to the surface of your nipple and suck that in, so with a little syringe. So there are the options. Now, why would you express before your baby's born? Main reason is that it is some way for mothers who have diabetes in pregnancy to be encouraged to have some colostrum, extra colostrum available once their baby is born. Because mothers who have diabetes in pregnancy, whether it's type 1 diabetes or gestational diabetes, their baby womb, and so they often need extra. And in order to avoid giving them artificial milk to maintain the blood sugars, those mums are recommended to express some colostrum beforehand. And what they are doing, they're collecting it in syringes, and there's usually a little stopper that comes with it, and they label it with the date and the time, and they do it twice a day from 36 weeks onwards. So in the morning or at night for 5 minutes. That's it. And some mothers might not get anything anyway. But if they don't get anything, that's not a bad thing either, because the one thing that you know very well is how to hand express colostrum after the baby's born. Now, why would you do it after the baby's born? You may have a baby, like this baby, who's just wanting to sleep. So you try to bring your baby to the breast, and you kind of have your baby even maybe skin to skin, which is a really good way to feed a baby in those early days and weeks. And the baby is just not waking up. And you know that you need that stimulation, because that's how the milk is switched on. So we need to remove colostrum, we need to stimulate. And if that's not happening because the baby is sleepy for whatever reason, maybe it was a long labor, maybe it's a baby who's been born a little bit early. Sometimes it could be also some of the analgesias in labor. So what you can do then is, first of all, lots of skin-to-skin contact, which of course I'm not doing right here, but just imagine that I'm, skin-to-skin with my baby. And then what you do is you are expressing for your baby whilst your baby is maybe skin-to-skin, because that switches on your hormones. And you then express. And then when you've got a little bit of colostrum, you only need a couple of mils of colostrum for that first feed. You can sit your baby up a little bit, and you can give your baby, I hope you see that, a little bit of colostrum. What they do is they lap it up. So you can give it via the cup, or you can do the spoon, or you can get that colostrum into the syringe and then give little drops into the side of their mouth, and they will start swallowing it. And sometimes it's actually a way to wake the baby up for the breast as well. So this is just a little bit of information today, and I'm so sorry that we got interrupted with some technology here. A little bit of information on why colostrum is so important for your baby, why you may want to explore expressing before the baby is born, why it is sometimes important to do it afterwards. And there's one other question that you may want to ask me. Can I use a pump? Because I do get that question. The reason why you would not use a pump at this particular time is that the colostrum is such a small amount, you are losing it in the equipment. So if you get some colostrum with a pump, it would just be really kind of almost like a smear in the shield of the breast pump. And it's really difficult to, give it to your baby that way. Yeah, so that's one reason why hand expressing is certainly the better option initially for that reason. So if you have any questions, maybe go on our website, parentinggenie.com, or you can also join our community. And there's also some Facebook community group. So we are around, and there's also a few midwives who present for Parenting Genie. And yeah, we'd love to hear from you. So I hope that was helpful, and I'll see you in a week's time on a different topic. Thank you for listening, and thank you for watching. It's not letting me go. That's always the problem, isn't it? To have such a problem. So bye for now again. I'll try again.